Hi, this is Dr. Randy Roberts with the Utah Smile Clinic. I am going to go over this patient with you today. You can see that on his top teeth, they've been ground down a little bit, and he had gone to around 30 consultations over 3 years trying to figure out how to get his beautiful smile back. So what we decided to do, you can see those back 2 molars are still in great condition, but all those anterior teeth are worn down severely. So we decided to preserve his good bone and good gum tissues and extract those front teeth and do a 3-on-6. And so here you can see I've atraumatically pulled those teeth out and placed that surgical guide, which means that we have pre-planned implants, so we know exactly where those implants are going to go before the surgery. So now he's got those implants in there. We're going to place some abutments on top of those implants. And after those abutments are placed in there, we are going to place the dice on there to take a scan of his teeth. And then after those dice are on there, we can get that scan. You're going to see that green light pop up for a second. There's that green light. Yep. Now we're going to put on those little white caps and we're going to do another scan. That's going to be the tissue scan. And now we're going to start bone grafting. You see us put the bone in there. And here you can see the design of his teeth. He's going to get immediately 3D printed teeth. So here we're designing his mouth from what's in his mouth. Here's the 3D printer. We are doing a same-day 3D printed conversion of his mouth. So he has beautifully designed teeth on the same day of his surgery. Now we're just going to take those teeth and we're just going to screw them right up there into his mouth. And he's got a beautiful new smile. This surgery for one arch takes around 3 hours. Now you can see I'm adjusting his bite, testing it out to see how it feels when he's biting, make sure that there's no high spots. And here's a picture of his teeth the next day. Look at that beautiful gum tissue. And look at that beautiful new smile that he's got. All right, now we're gonna ask him some questions. All right, we've got Steve here. Steve just had his upper 3-on-6 surgery yesterday. He flew in from Georgia to get this done. And what are your thoughts, Steve? One day, only like 12 hours after surgery, how you feeling?
Feel really good. I can barely tell I had it done at all. A little bit of pain, not much. Really overly impressed, and I thought a lot better that it came out than I thought it would. What did I say about the mechanical thing? I felt like it was going to be more like of a false type, mechanical type device feeling, and it actually feels pretty much 99.9999% real.
So what were you just saying?
So another thing is that when I was saying that it would feel more like false or mechanical, when you feel your real teeth and you feel your new teeth, it's exactly the same feeling as if it was both real teeth. I can't even tell the difference.
Now check out those beautiful gum tissues. So he's going to wear these teeth for the next 3 months, and he will come back to start working on his finals. I hope you've enjoyed this video. Thank you for watching.